for the technical glitch and for having to switch connectivity at the very last minute. I appreciate everybody that could jump on. I know Terry is on. Terry, I want to tell you thank you so much. We're excited that you're going to.
Thank you for having me.
Because that was such a last minute change here, but I want to call to order today's meeting of the Appropriations Human Resources Subcommittee. And we will get started. This is going to focus on the amended 21 budget and some status updates from our commissioners and agencies to make sure we're all ready to do this budget. I think, as Chairman England said today, very quickly, and be ready to make sure that these dollars are where our agencies and those who need it can best receive them. So I believe first up, we will hear from the Robin Crittenden. Ready? We'd love to hear from you.
Thank you, Madam Chair and committee members. If you think we're just pulling up the presentation. Great, thank you. Thank you for the opportunity to come before you today to discuss the governor's recommendations for the Department of Human Services amended fiscal year 2021 budget. I have several members of my leadership team here with me today to review this. The Department of Human Services vision is to build stronger families for a stronger Georgia. And with each policy, program, and service we provide, we ask ourselves, does this help build stronger families, and as a result, a stronger Georgia? And this year, we've been asking ourselves that question quite a lot as we've made changes to how we work and how we do business during a global pandemic. As of March 23rd, the majority of our workforce transitioned to working remotely. Child support customers are directed to self-service options for conducting business with the department. And in the event we are unable to resolve a customer inquiry that way, staff see customers in the office. In this new environment, productivity is stable and all employees have the required equipment to work from home. There has been no disruption in services, and all frontline staff have received proper PPE. This includes both APS, Adult Protective Services, and Public Guardianship, as they've continued to provide services to their clients. With our mission in mind, here's how we use our resources to accomplish our goals, adhere to the laws governing our programs, and hold ourselves accountable to the public trust. DHS has about $1.6 billion allocated to protect and serve Georgia's vulnerable populations. When you add the budgets of our attached entities, the total for the department's fiscal year 2021 budget allocation is $1.8 billion. Now we'll take a look at the governor's recommendations for amended fiscal year 2021 for DHS. Overall, for DHS, the governor has recommended an amended fiscal year 2021 budget of $800.4 million in state funds. This amounts to an increase in expenditures of $4.4 million for amended fiscal year 2021. The governor is recommending for departmental administration a reduction of $537,000 to reflect the 6.2% increase of the Enhanced Federal Medical Assistance Percentage, or EFMAP, during the COVID-19 public health emergency. Also, for departmental administration, the governor has recommended providing funds to begin implementation of the Patients First Act, which was passed back in the 2019 session. DHS is responsible for the system upon which the program will operate. This amounts to $4 million in state funds in amended fiscal year 2021. The governor's final recommendation for departmental administration is an increase of $1.3 million for the Georgia Gateway Cloud Migration implementation.
Katie, can I ask a logistical question? Forgive me for interrupting, Commissioner.
Sure.
What tracking document am I supposed to be looking at? Because I am looking right now at pages from the beginning on 39, page 39 of the House Bill 81 tracking sheet. I'm trying to figure out what the commissioner is looking at and how it relates to tracking documents. Am I just totally confused here?
I'm using the Human Resources Subcommittee tracking sheet.
Okay, and that is different than the House Bill 81 tracking sheet. And I think that what you're talking about has been sent to me, but is it possible that Michael could resend to me what you're talking about specifically? So I have the right sheet in front of me. I'm sorry to interrupt. I'm just
No, you're fine.
confused about where we are.
Might be the most recent. If you're able to pull that up at all, I know we're all doing our best right now.
What did you just ask? Pull up what, Katie? That's what I'm.
Michael sent an email of the
When did he
latest
send it?
tracking sheet last
When did he
night.
send it? That's what I'm
Last
trying-
night.
I'll resend it now.
He's resending it to you right now.
Okay,
So we'll
thank
have
you.
that again.
Thank you. I
And
apologize.
the date, just so you know, like the date, no, it's okay. The date on the bottom of it is January 15th, the one that I'm looking at right now. And we're just going to look at the amended for today as well.
Okay.
And we may have to answer this a couple of times as we move forward in this. Thank you, Commissioner.
Thank you. Would you like me to wait a minute or go ahead?
No, I'm sorry. Go ahead.
Okay, thank you. The Families First Coronavirus Response Act, or FFCRA, is an act of Congress meant to respond to the economic impacts of the ongoing COVID-19 pandemic. Among other things, the act provided funding for free coronavirus testing and 14-day paid leave for American workers affected by the pandemic. The Coronavirus Aid, Relief, and Economic Securities Act, or CARES Act, provided fast and direct economic assistance for American workers, families, and small businesses, and it preserves jobs for American industries. DHS received $6.5 million in FFCRA funds to provide home-delivered meals and congregate meals to Georgia's vulnerable and disabled populations, and $23.3 million in CARES Act funds for home-delivered meals and to aid those individuals with supportive services, such as personal support services and assistive technology that will allow them to remain in their homes. With the exception of long-term care ombudsman and ADRC funds, all of these funds were sent to the AAAs. The Georgia Vocational Rehabilitation Agency, Council on Aging, Family Connection Partnership, and Safe Harbor for Sexually Exploited Children Fund Commission are attached to DHS for administrative purposes only. These are the governor's recommendations for the entities that are administratively attached to DHS. Questions pertaining to the budgets of these entities should be directed to their leadership. This slide provides the contact information for each of them. That concludes the governor's recommendations for the Department of Human Services amended fiscal year 2021 budget. Before I leave, I want to bring to your attention that detailed information on the department's performance and accomplishments for state fiscal year 2020 is available in our state fiscal year 2020 annual report. A link to the report was sent to all members of the General Assembly on December 29th, 2020. However, you may also locate the report on our website at dhs.ga.gov. Thank you again for the opportunity to speak to you today. Please don't hesitate to contact me should you have any additional questions, but I'm happy to answer any questions that you have today. Thank you.
And I think Representative Oliver has a question.
Yes.
Thank you very much. I can't back up your slides myself, but one of the things I'm trying to get straight in my mind, and this has probably been explained to all you and you understand it, is exactly, you had a slide up about what was CARES Act money.
Yes.
Yeah, this one.
Mhm.
This is an example, kind of a general question I have, and then you and Mr. Rollins can both answer this when it's his time. This shows me that all of these monies of the $23 million has been paid by CARES Act. And that tells me, I just want to see if I'm reading this correctly, that the cuts that Human Services received in our June budget for home delivered meals have been restored based on CARES money. Is that what I'm looking at? Is that what is accurate?
So we did not receive cuts on the meals in the last budget. But these were additional funds that were on top of the state budget. And so they're not recurring funds. They're just from the CARES Act and the Families First coronavirus.
Do you have any, you being Department of Human Services, and then Mr. Rollins can answer for defects, do you have any CARES money still in the bank that's available to you for any purpose?
So we have, we sent the money out to the AAAs using the federal formula for distribution. It has not all been expended at this point. Demetrius, you're here, you can correct me. This, because it's different categories of funds have to be spent by different points. I believe this has to be spent by September 30th, and then the other category by December 31st. Of both of 2021. So they're still in the process of spending those.
But for what you're in control of, family caregiver support, long-term ombudsman, you don't have any additional CARES money available to you that you're aware of it, that the governor's released to you at this time.
Our money has come not through what the governor released. Our money has come straight through from the feds.
And I'm not talking about the new proposal. I'm talking about what's already been passed Congress. There's no new money from the previous CARES.
There will be.
That,
I'm sorry, go ahead.
Is there any new money you anticipate from what is already passed Congress, not from what President Biden is?
Yes, there is some additional money from what has already passed. We don't have those amounts yet.
Katie, see, that's what I'm trying to figure out. I can't figure out, this is, and then I'll hush, but we cut $2 billion from the budget and we've restored X dollars to the budget. But I can't figure out if it's all CARES money in addition to the, I can't figure out where the CARES money is filled holes and where CARES money is available and still available, other than the $465 million that the governor says he's holding. Do you understand that? Maybe Michael understands that. I don't understand it.
I'm looking across the table at Michael to see if he understands it, because he's,
OPB has some tracking on their website.
OPB has some, but it's not, it may not be what we're trying to get.
Yeah,
So,
I've looked at OPB's website and I'm just not clear yet. Well, let me ask the question this way, and then I promise I'll hush.
no, we need your questions.
How much did you have before the June budget? How much was cut by the June budget? And how much do you anticipate getting back based on CARES money and the governor's budget? What are you still being cut? Commissioner Crittenden, do you know?
Yes. I'm looking for this sheet. These CARES funds, as well as the Family First funds, were above our state funds that we received.
Has your budget been cut in any form after the
year.
governor has made his proposals, for assuming we pass what the governor wants in terms of the supplemental budget?
Our current budget hasn't been cut?
Mhm. Assuming we pass the supplemental budget,
No.
you're fully restored to the 2020 budget.
Oh, fully restored?
That's my
No.
question.
No.
So what's missing in the 2021 budget that you had in the 20 budget?
I'm not
Those
sure.
questions make sense?
I'm not sure I'm following your question.
No. Maybe I'm not making any sense.
But I'd be happy to come and we can set up a separate meeting and walk through the budgets with you if you'd like.
Michael, do my questions make any sense to you?
Are you inquiring about what items need a restore
I
compared
want
from?
to know
20
what
to
has been
21?
cut that we are not restoring.
And that's
Anything?
really important. Yeah, it's really important. I understand you may not have that right at your fingertips today, Commissioner, but maybe you could forward that on to Michael for us to look at kind of quickly.
Absolutely, I can do that. And just so I can make sure I understand what you're talking about. We took reductions in things like travel, which we've not put back in the budget this year. Contractual services, different kinds of things where we actually took these reductions and which ones are not restored. Is
Yeah,
that
you're not going to restore conferences between now and June 30th, for instance.
right? Okay, we'd be
I'm
happy
just-
to have that for you.
Thank you. I'm just trying to figure out what cut in services are we absorbing that the CARES Act and the governor's supplemental budget's not paying for. That's what I need to know.
Understand.
So really focused on services.
Yeah.
And Commissioner, if it's at all possible to get that to Michael tomorrow, I don't know if you can do that at some point, and then we can get it to the members for you.
No problem.
Thank you
very
so much.
Thank you.
Thank you. Are there any other questions from the committee members that are continuing to log on a little bit? We have a few more with us now. And I'll apologize again for any technical issues we're having. We apparently everyone is trying to do their meetings right now, and it created a little bit of a problem. Okay. Not seeing any questions, then I believe we are ready for an update from the Division of Family and Children's Services Director Rawlings, please.
All right, thank you, Chair Dempsey. Tom Rawlings, I think I do have a very brief PowerPoint that somebody may be able to put up for me. Well, let me go ahead and just go over the stuff because it's very brief. Just to clarify, I'm using the House Budget and Research Office tracking sheet dated Friday, January 15th at 4:31 p.m. Just a few things. Again, kind of repeating what I said this morning, we were fortunate in the 2021 budget session that our overall budget was cut by only about 3% overall. If you look at our total budget, it's about $650 million in the state. The rest of the $1.4 billion total is federal. This past year, we've been able to issue about $3.5 billion in food assistance, primarily SNAP. But we also, of course, are working with our community food banks. We work with the Department of Education to put through the PEBT program to replace school lunches, and we'll continue to do that this year. PSNAP, of course, increased dramatically the amounts we were putting out in food stamps. So, and then, of course, our foster care numbers have continued to decline, down by about 25% total, or about 3,800 since its high water mark in March, around March of 2018, down to about 11,200 today. We are, of course, keeping as close to our home being our agency, so to speak, in our care, young adults who would otherwise have aged out at 21, keeping them with us through the time of the pandemic, because we don't want them going out into a world where jobs are difficult to get, especially. So in terms of our actual 21 amended budget changes, I'll direct you to 28.1.1 under adoption services. This is under the Department of Human Services budget. It's really a net nothing. It's not a change, but we have received $3.5 million additional in FMAP, thanks to the fact that although we didn't get any CARES money ourselves, there was an overall boost to the FMAP participation from the feds of about 6.2%, which in our case for adoption assistance services amounted to about $3.5 million. So we're able to use those additional federal funds, which we otherwise would be coming to ask you for, because our adoption assistance has increased dramatically over the past few years as we have increased the number of adoptions. If you'll turn the tracking page at least, it's on the same page, 28.7.1. Again, we've got some savings from the FMAP for our SNAP program. As you can imagine, as we issue more EBT cards, we have to pay more administrative costs associated with those. So really an increase in state funds of about $412,000. 28.12.1, which is on the next page. Under federal eligibility benefit services, we are increasing funds for the State Office of Administrative Hearings. We have a contract with them, at least for amended 21, of about $750. About 2/3 of that is for SNAP appeals and 1/3 for Medicaid appeals. This is really somewhat of an accounting change, because in past years that was either directly sent to OSA. I think we've kind of worked out more of a contractual arrangement now, and to pay for their services in handling those appeals. 28.12.2, providing, of course, we're going to begin to implement the Patients First Act, which we expect to add about 50,000 members to the rolls of medical assistance rolls. You'll see that the bulk of that money, of course, at DCH. You'll also see a significant investment at the DHS IT level in terms of getting the equipment and the data systems and the computers and all ready to add on those additional duties, those additional screenings and additional capacity to bring on those applications. On our end, gain of about $707,000 to increase staffing levels to cover those additional eligibility applications that will be coming in. In out-of-home care, that's 28.13, 28.13.1. We are going to be reducing our need for state dollars by about $2.2 million, again, thanks to the fact that we've received a boost from the feds in their FMAP coverage. And then similarly, on the SNAP EBT cases, a reduction of 412. You can basically see a kind of a shift out of home care there, and then so we basically shifted that money from out of home care and into the additional costs associated with the SNAP program. Just one other thing I want to highlight for the amended 21 is under 28.25.1, the next page, which is the Safe Harbor for Sexually Exploited Children Fund Commission, which is under us. That commission, as many of you know, has money set aside from fines, fees, and I think sort of assessments against adult establishments. It's been the subject of litigation. That litigation is still going on, but we do believe that we've got about $650,000 in that fund and can start to allocate some of those monies toward providing services for victims of child sexual exploitation, commercial exploitation, and other similar services available through that law. That, of course, we are doing in conjunction with the Criminal Justice Coordinating Council. That's a fairly short presentation today. There's not, we have what I consider overall for this year, a fairly flat budget. But I'm certainly here to answer any questions. I would, and I'm going to anticipate even before Chair Oliver asks me a question, I'm going to go ahead and tell her, we did not get any specific CARES money in those first federal outlays. However, in this last one in December, I'm going to go through a few things that we will be getting or are getting. One is that between January and June of this year, there's an additional 15% added to SNAP. So it's all federal money, it's just flowing through us, but that SNAP payments will increase by 15%. See, in the we got about, and I guess this is nationally. If you consider, we'll probably get about 2% maybe of these funds. So $400 million nationally for the Emergency Food Assistance Program. An additional $13 million nationally for the Commodity Supplemental Food Program. We, of course, work a lot with the food banks on that, and in fact are working with them right now, not only to work on these particular funds, but on working on finding how we can come up with additional funds to assist them. We know the food banks have a lot of work to do during this time period. Let's see. There was, I believe, one. Oh yeah, I'm sorry. The other two. One is last year we had the PEBT program to, of course, work with the Department of Education and provide these funds to families that had to pay for their children's meals when they should have been receiving free and reduced lunches at school. We last year had to pay the administrative portion of that ourselves as a state. This year, the Congress has seen fit to, they will be reimbursing us for that administrative cost. We don't know the exact figures yet. And also they are going to be distributing about $100 million nationally, again, to help all of the states who are administering food stamps to really kind of cover that additional cost of administration when our caseloads have been so high. We've issued $3.5 billion, as I said, in the last year, and that's a lot of money and a lot of extra work for us. So that's all I have for the moment. With Representative Chair Oliver, I don't know if that answered your question.
Commissioner, can you hear me?
Yes, sir. Representative Donahue, how you doing?
I am doing good, sir. I wanted to make sure I understood something. You said every time the EBT card was used, of course, there's a fee like a debit card or a credit card. Is that pretty much right?
My understanding
do we know what
is,
the fee is, or is it what?
It's what we have to do is we have a contract with a company called Conduent that produces the card, and for each card that is produced, they charge us a small fee. But as you can imagine, the more cards we have out there circulating around, especially with the PEBT program, with the 35% increase in the number of families on food stamps, that increase. I don't necessarily believe there's not necessarily a per transaction fee or anything like that. It's more of the cost of producing the card and distributing the card to the family.
Okay, and thank you. And then I heard, I get my phone never stops, so I'm on my phone here, and I'm getting beeped in and missed a couple of the things you alluded to. You said that there were still jobs that people were not able to find, pretty much, or did I miss that part?
Yes, sir. I think what we're saying is, especially with regard to our youth. So we of course, you could leave foster care at age 18. We certainly try to encourage our young people to stay in foster care until 21. During that time, of course, we help them get life skills, find a job, get a college or a technical college education, help them learn to be young adults. Since would be difficult for many of them to get jobs right now, we are continuing to support them even after they turn 21 recognizing that this is a difficult job economy for the young person who is coming right out.
Okay. Thank you.
Representative Oliver.
We talked a little bit about this morning, about the leads contract. That's a cut you talked about this morning. Where is it reflected in our budget tracking dollars? That
It was a cut last year, so there's been no change. It was cut partially last year, is what I was saying.
in the 2020
In
budget?
the 20, yes, sorry, in the original 2021 budget. So the one we passed, the pandemic budget that we passed in the summer, there was a cut to that. It wasn't a full cut, it was a partial cut. And what I was commenting on in response to the question I had was that we sort of we asked some of the philanthropies to help fill in the gap there, but we do anticipate, especially as hopefully the economy continues to grow, that we will look for ways to put those funds back in. We think it's a great program, and we certainly want to keep funding it. We were not able to completely fund it last year. There's been no changes in it for this year. So what we did last year will continue through this year.
I guess I'm asking the same question I was asking Commissioner Crittenton. In the
Right.
2020, in the June budget is what I'm
Right.
talking about, the June budget. What are you missing in that you're not restoring via CARES Act or via this governor's recommendation or via anything else?
Sure. So I think probably what we're focused on, again, I think our cuts overall last time were fairly minor. We cut out some positions, really not laying anyone off, but just kind of eliminating some positions. We have not restored those. However, we are continuing to hire both eligibility workers. I think we're trying to hire about 150 right now. And we had already done a lot of hiring, as you know, with our child welfare workers, and we're continuing to hire those. So I think probably the things that were brought, that were sort of the things that had to be cut back a little bit last time that really were dear to a lot of hearts. One of those, of course, was the MAC Leads program. We did cut part of it. We're able to restore some of it. And we have not fully restored that yet, although we understand that for this year, they have gotten philanthropic dollars to fill the gap. And Chair Oliver, I don't remember any other specific things. As you may recall, we do have some, we didn't get CARES Act funding. We did get some funding from the Family First Prevention Services Act Transition Fund that has allowed us to fill in some gaps that might otherwise have been a little bit difficult, especially in the area of our technology improvements. We are looking forward, I think it was safe to say, to these, especially on the OFI side or the eligibility side, to getting the funds to cover administrative costs, especially with PEBT and SNAP cards and that kind of thing.
I know this is worrying you too, but I'm trying to figure out what's your best expert analysis as to the drop of child abuse complaints based on the children being not in school and the recovery of school. What do you think we've missed, and what do you think is going to show up in our budget, if anything?
So think about longer term. It's not showing up in the foster care numbers. I think we'd probably be even lower in our foster care numbers right now had we been having regular court hearings.
Right.
Because we have made a concerted effort, as I've said. I think we all agree that if we can keep that child safely in the community with his or her relatives, friends, parents, et cetera, that's better for the child. So each 1,000 children in foster care is about $20 million in expenses. So I'm not so concerned about the drop in those numbers.
I'm not either.
What I am concerned,
right.
Yeah, sure. I think what's right to be to pay attention to, of course, is that we had a drop between March and say September in terms of mandated reports coming in from educators, that dropped to about summer levels. Now, what that means is that we were not getting a lot of what I'd call lower level reports, and not they're, you know, these families are in need, but not necessarily reports of severe imminent danger for children, but low level risk, poverty issues, need issues. And I think our numbers in terms of reports of, like, for example, family violence, law enforcement reports, hospital reports of severe abuse were continuing to come in. I do remain concerned, of course, that there's always out there may be some child, for example, who has developed a chronic medical condition during this time being away from school, and whose parents are not paying attention to that. And that child may, in fact, suffer long-term effects of not going to the doctor, and also of not having a teacher to say, hey, this child looks like she's sick, she's been in this way for a while, and she needs to go to the doctor. So I think that's what I'm concerned about.
What I'm thinking about, and then if 30,000 children didn't show up for school,
Right.
that we anticipated showing up for school, that's the crowd that I'm kind of, most of those children are fine. You know, the parents are dealing with pods and all that.
Right.
But what percentage of the 30,000 children are invisible? And that's what I'm worried what's going to show up in your.
Yeah. And Representative, I was thinking that you and I talked about this. I know Michael Waller at Appleseeds has been very involved in this issue. We have been trying to work with him to figure out a way that we can legally track, sort of get some data for that. Okay, there's some limits as to how we can use Medicaid and SNAP and other data, but we are working with them in DOE to try to figure out what we can do. I think that what we're going to see, unfortunately, is that, and I'm hopeful that it's not going to be a situation where a child is suffering severe emotional or physical damage from this not going to school or being out of the school system. I do think we're going to see children who have fallen behind in school, and especially if those children are in our poor or in a lower socioeconomic category, it's really going to hurt them in the long run. So we do have a lot of work to do when everybody's got a vaccine to get these folks, to get these children assessed and tested, and perhaps get them caught back up in some way. But I certainly understand your concern.
Thank you. I know you're concerned too.
Representative Howard. I think you're on mute still.
Okay, can you
There
hear me?
we go.
Okay, thank you, Madam Chair. Mr. Rollins, my question is going back to and I apologize if you may have answered this in your presentation, but in the SNAP program, is there a way for us to see the increase or decrease in our area, maybe in our region or in the areas that we represent, not so much the state, but no.
Oh, yes, sir. We have, I'm going to get, I know that I'm pretty sure that my legislative director, Kevin Harris, is on this call right now. You ought to be listening in. And what I can do is get you the SNAP numbers for your district. We break it down by county, at least, I know. And I'm certainly glad to help you see how much, like, for example, what we did in 2019 in your district as opposed to what we paid out in 2020. So that'll give you a good example of how the COVID relief, we have found that the economic impact of the virus in terms of especially our lower income families has been consistently spread across the state. And so one of the benefits of our SNAP programs that we have been able to inject a lot of money into local economies, which I think has helped spur economic activity as well as keeping folks fed. And we can certainly get those figures for your jurisdiction. And if anybody else wants them for their jurisdiction, I'm happy to provide those.
Okay, that'll be good.
Yes, sir.
All right.
Are there any other questions from the committee? I'm not seeing any, but if I'm not seeing anyone and you need to just shout out, feel free to. Okay, well, if not, we may have some more later and we'll get in touch with you about them. Thank you so much, Director Rawlings.
Yes, ma'am. Chair Dempsey, you always know whenever y'all have any questions, I'm here to help you out. I want to really express my appreciation to Michael for all the help he's given us, not only on sort of, working toward this budget, but especially in terms of the work we've been doing on our therapeutic foster care initiative, which you'll hear more about, especially as we talk about the 22 budget. So thank y'all so very much, and y'all have a good afternoon.
And we are very interested in therapeutic foster care, so just be aware of that.
Yes, ma'am. Thank you.
Michael and I have been talking about it today, so thank you.
Good. We'll see you.
Good. Well, now it is my pleasure to make sure that those of you that are on the call get to meet one of our newest directors. Chris Wells is with Georgia Vocational Rehabilitation Agency. He came after we worked on the last budget, but Michael and I both have had some great meetings with him and look forward to you bringing us up to date today. And there will be more who will need to meet you. We had a technical issue at the beginning of this, so I think some of our members are still struggling to get on, but we'll all get together.
Thank you so very much. Thank you. Thank you. One of the things I just wanted to start off by thanking you, Chair, and every individual on the call. I definitely want to send my appreciation and thank yous to the governor's office, to OPB, and a lot of the agency heads that I've had an opportunity to develop a relationship over the past few years. You don't get the opportunity just to say thank you. And I just wanted to start off this particular conversation just to say thank you for just all the support, all the help, all the understanding as I've gotten up to speed. And also want to thank the providers and individuals that are out there that have given me a call to express concerns and understanding of which direction GVRA is going in. And I hope we've been able to kind of answer a lot of those questions. There's a lot of work to be done, but I'm excited to be over here. I feel like there's a lot of support from every single individual that I've spoken with over the past few months. And so if the only thing that you remember today, just remember two words, and Chris Wells said, thank you. And I think a lot of times we don't get that opportunity just to say that. So I just want to say thank you for everyone. Initially, just wanted to kind of go through our particular budget for GVRA and amended. Our budget was relatively flat. If you were to use page 5 of the tracking document, you can see that there were no adjustments or no changes. We submitted a flat budget, but we wanted to provide just a little bit more information from a programmatic perspective so everyone can see how those funds are broken out with our business enterprise program, which is about 14 employees, spent about $2.7 million last year. And so coming into this particular year, you can see in reference there to 28.2, what our total budget is broken out by state funds, federal funds, and also our total funds. You can see admin, we're considered about 60 individuals in that particular program, spent about 9.4 on last year. And so our budget is very consistent to what we spent on last year to make sure that we were judicious with the funding that was provided and that we're seeing. Our disability adjudication services is a 100% federally funded program, which helps with SSI and SSDI determinations. That's our second largest program. And as you can see there, our budget is approximately $70.3 million. And again, you can see that in lines 28.2 2. And then we have our Georgia Industries for the Blind. Again, that's a program that's about 57 individuals. We spent about 5.4 last year, which revenues were down approximately $1 million on last year. We're hoping that we can diversify our product line and develop some opportunities in the future to make sure that we're diversifying and that we're creating opportunities for individuals in our sensory community there. And then lastly, our biggest program that we get a lot of questions on that drives the agency for the most part is our vocational rehabilitation program. Within our vocational rehabilitation program, we do have 2 residential programs, which is Roosevelt Warm Springs, as well as Cave Spring Center. And so these are the 2 areas that, 2 of the 3 areas that make up VR. And then VR is one of our largest programs outside of Roosevelt, Warm Springs, and Cave Spring. And so you have an employee base of about 603 individuals. Spent about $92 million on last year. And so we're estimated to spend about 87. And so we're budgeted there for 87 million. And again, for amended fiscal year, we have no changes to speak to. But we did want to take this opportunity just to update the committee on a couple things. So for example, with our BEP program, we did not receive, or business enterprise program, we did not receive any additional federal funding there. However, during that process and during the last COVID relief or stimulus funds that we received, notification that there was additional funds in that particular budget to allow for us to provide grants to our business enterprise community. What we're seeing there, because a lot of our cafeterias, snack bars are situated on federal properties, and a lot of our federal vendors have been closed for these last few months, that has impacted revenue. And so what we're seeing there is an increase in the federal budget there to be able to offset those revenue losses. Another area, our Roosevelt Warm Springs, our residential campus, we had an opportunity to do a lot of online curriculums. And so we've seen some success there. We had an opportunity to open up campus in early November for those students that needed to be on campus for some of that hands-on guidance. We were able to go through that particular process and release the students back prior to the Thanksgiving holiday. And we're hoping and looking for opportunities in this next 6 months to be able to open campus up again for additional students. Our disability adjudications program, again, one of our largest programs and federally funded. We were able to work with our federal partners to receive a lot of laptops to be able to move towards a teleworking environment. There was a slight interruption in services as we were working with our federal partners to better understand the flow of those funds and get those resources in to be able to start that teleworking process. And since about April or May, we've been teleworking for the most part, providing services. That program is not necessarily a front-facing program, so a lot of those services can be done via the teleworking model. And so we've been working to make sure that we continue that process to make sure individuals receive their SSI and SSDI payments. One of our biggest programs, again, vocational rehabilitation services, the program is still open. The doors are still open. However, we've had to monitor our social distancing and also promote safety for not only our clients, but also our employees. And so we've gone to a virtual model as well there. We have minimal people in the office while we're practicing social distance. However, we are taking appointments and trying to find different ways to be able to work with our clients to be able to get them the services that they need. And then finally, our Georgia Industries for the Blind. We've deemed everyone that's working for our Georgia Industries for the Blind for essential employees or essential services, essentially because that program, as you can see here on the slide, does not receive state funds. We felt it was pertinent to continue to move forward and work with our federal partners to ensure that we were executing the contracts and providing services in order to keep operations flowing. We do feel that we've made some adjustments on the expenses side to be able to account for some of the revenues that we've seen over the last year. There is some good news, and we've been working with Mike Jackson and his team down there for the last few months, working with the governor's office and working with the Office of Planning and Budget, Department of Administrative Services, and also GBA and GISFIC. And we were able to leverage some bond funding to purchase a pleated mask machine. And so we anticipate in the next couple of weeks to the next 4 to 6 weeks that we'll have a pleated mask and machine to be able to produce mask. And so what we're hoping to do with that is work with our federal partners to be a part of the federal procurement registry in order to supply pleated masks for our federal partners, as well as partner with our state agencies for those individuals that may need that particular service. And so just wanted to provide a quick update for our various programs. There's a lot going on, but we're definitely working. Historically, we'll just go through a couple quick slides. This gives you an idea of our historical spend pattern for the agency itself. And you can see in 19 and 20 where the pandemic hit and kind of where we are right now. Our next slide. This gives you a quick example of, from an agency, how large of an agency we are. As you can see over the years with various changes, the number of employees have steadily increased and declined. And so we were on a decline these last few years. but we're making adjustments to be able to leverage IT and leverage better processes to be able to make sure that we can move forward and serve our clients. And so that's the crux of our presentation. I'll be more than happy to take any questions that any member of the committee may have. Thank you so very much.
So feel free to kind of shout out or raise your hand in person if you can.
Mr. Wells, I appreciate very much you coming to visit with me. I enjoyed it very much.
Thank you. Thank you so very much. Thank you.
That's just your resume. You and I talked about last year's Expenditure report. You're going to send that to me with an update as to where you are on that kind of that improvement plan. I appreciate it. Thank you.
No problem. And that's one of the things that, you know, in working with our partners in the governor's office, as well as OPB, they've done a really good job of support and kind of helping us better understand, you know, what are the things that they're looking for and how we can be better service to not only to OPB, but also to the General Assembly. So that's an area that we've tried to basically consolidate some of the recommendations of the Expenditure report so they're easily accessible. So individuals that may be seeing that can see and understand what progress we've made towards a lot of those recommendations. And so I truly appreciate that you had a chance to look at that, and hopefully it was helpful.
I don't think I've seen it. I probably could have missed it in my, you know, please resend it. I'd like to see it. Thank you.
We definitely will. So sorry about that.
Thank you.
Any other questions from the committee? Well, Director Wells, let me ask you this, not seeing any. I know about some of the impacts and trying to work and deliver services. What would you say right now? What's the toughest situation that you felt through that?
I think right now it's you know, being judicious with the funding that we currently have. I think, you know, in terms of getting up to speed and making sure that individuals we serve have you know, the resources that they need. And I think part of the evaluation in coming in is that with the help from the General Assembly and also with the help of OPB, we've been able to kind of do a deep dive in kind of where we're spending money, how we're spending money, how can we leverage technology to be able to be more efficient and be effective. And so I think over these last few months, what's been, you know, very difficult is peeling back the various onion peels and making sure that we understand where the money is going. So when there is opportunities for us to represent not only the individuals we serve, but, you know, if there is a needed request or initiative, that we can not only show where the money is going, how the money is being spent, and what are those performance and KPI metrics that can back that up. And so that's one of the things that we're trying to move towards as an agency. And then I think the second part of it is understanding that, you know, the clients that we serve, there are a lot of things that I'm even learning, you know, being a math major and being an individual that's been always focusing on the numbers outside of being a teacher for a year. There's a lot of things that you have to consider and understand, and there's a lot of moving parts. And so I've had a lot of individuals that have reached out to educate me. I've had a lot of our individuals from the sensory community and a lot of our stakeholders on personal calls, educating me on the needs. And so there's a lot of needs, but I think one of the things that we're trying to do and what we're trying to articulate is before we can go out and request 1,000 different things, we want to make sure that we are serving and we're maximizing, and that when those opportunities present itself, our customer service is improving, that we're getting individuals through the VR process a whole lot quicker, and that we're being responsive to individuals that may feel like we haven't done everything that we needed to do in the past. And so those are the things that we're working on. I like to move quickly, but what I'm learning very quickly being on the agency side is sometimes things don't happen as quickly as possible, but our team is working hard and we're doing everything that we possibly can to make sure individuals that they felt like they've been left behind, that they are seeing GVRA make moves, they're seeing GVRA improve. And that's one of the things that I just want to leave with the organization is improvement, and let them know that we are working hard. We've seen some adjustments, we've seen some changes, and that there's a lot of support, and I know we're going to get this right.
Well, thank you. And I know you've worked hard on the cuts that were in the budget last on how you navigate, mitigate that. What are some ways that you've done that? But also what would you say would be best for us to really begin to think about? What do we need to get back in RA that is
Yeah, we're kind of in and out, so I hope I understood. I think one of the things that we're focusing on right now, and I can definitely share with the committee to make sure that they're aware, is I think over the past few years and looking at how we've spent money in the past is where we've spent money has not necessarily lined up to measurable skill gains and actually moving our clients and giving them those opportunities or affording the opportunities for them to move forward. And so what we're doing right now is we're evaluating and trying to look at the balance between how many people do we need. We can invest in technology, which that's what we're doing right now. Our model doesn't work. We're dealing with a lot of individuals and a lot of our clients. The barrier to employment outside of the perception from employers that they can't do the job is transportation and some of these other things. And so currently our model has a lot of field offices, and we're requiring the same individuals that is a barrier to come into the office to be served. So what we're doing right now is again, this is in the governor's strategic goals, is we're investing in technology, trying to create a website so individuals where parents can work with their children, and if they can help fill out an application, that we can get that application through the process quickly. So that's number one. I think the second thing that we're doing is because the budget reductions has again allowed us to look at what are our priorities and are we spending money appropriately, is looking at where we can redirect funds. And I think what we can do in the short term is redirect funds from some of the lavish travel that individuals have seen into personal services. And one of the initiatives that we're trying to do is increase the number of sensory counselors that we currently have. And also we have a group that's pre-employment specialists and transition counselors to allow us to work with students and potentially eligible students. If we can start working with students a whole lot quicker and working with the parents, then I think you'll see the numbers and the number of individuals we serve, because we'll be getting individuals early in the process and letting them and affording them the opportunity to understand what the GVRA process is like. And so as we currently speak with the flat budget and staying in line with the governor's initiatives, we are focusing in on those areas, and we're going to potentially open up the opportunity in the next few weeks and next couple months to hire additional counselors, backfill some of those positions. And I think once we do that, that's going to give us an opportunity to spread out the workload. Once we're able to spread out the workload, we can develop those interpersonal relationships with clients to make sure that they feel that they can call someone, have a conversation, and you don't have a situation where counselors are inundated with over 300 individuals that they're trying to work with. Again, I do want to take this time to basically say there's a lot in the news about GVRA, and sometimes our team that is on the front line, our counselors, they've been basically out front. They've been doing the best they can, but we, from an administrative perspective, we haven't done a really good job of supporting them. And so what we're trying to do over these next couple months is making sure that they have the resources. And if they have the resources, we think those resources that are afforded to them will extrapolate into better service for the individuals that we are serving. So that's kind of our step one and our step two. And we think we can do it we know we can do it with the current budget appropriations that we currently have.
Did you fix it up?
No, I shrank it. I turned it on its side. I did everything, and I
Okay.
wasted 20,000 pieces.
anyone else have any other questions at all or
Yeah.
comments?
Yeah,
I
go ahead.
have
I'm
one.
sorry.
That's
Okay, Emery,
Yes.
Wayne.
Can you hear me?
Yes, thank you, Wayne.
You have your program, I'm sure you do the same thing across the state. You have the counselors for developmental disability clients. When you were speaking about supporting those counselors, is that the group that you're speaking of?
So yes, sir. So we have what we call general counselors that work with individuals with disability, whether it's in our sensory community and different individuals that may have a barrier to employment. And so we work with those individuals, and we call those counselors, general counselors. A lot of them they receive their CRC, which is certified rehabilitation counselors, to be able to help and assist in that particular front. Part of our portfolio as well as we have transition counselors, and our transition counselors work closely with our school districts and our schools to be able to help get students and potentially eligible students acclimated to the VR process, help them understand what services that we have and to be able to assist. Thirdly, we do have what we call pre-employment specialists. And we've been working with our federal partners at RSA to figure out how we can maximize our pre-employment services funding stream. And so what we're doing there is trying to increase the number of pre-employment specialists that we currently have that can really go into the school district, that can really work with the students to help them with job counseling, help them with resume writing, and some of the soft skills that we're trying to implement. And so that's typically what our counselors consist of. Again, a general caseload. We do have specialty counselors as well. And our specialty counselors typically work with our sensory community, and they're able to help individuals get through the process. And so that workload is a little bit lighter, but we do have quite a few types of counselors that are working in various parts of the agency to be able to help us with individuals that may have a barrier to employment.
Yeah, I think it's good to hear that because I was one of your clients here in the Augusta area. And that was one of the things that I learned is that though the counselors were overworked, and so some assistance to them.
And that's one of the things that we definitely acknowledge. I think we've done. Robin, if you don't mind pulling up the slide, we had an additional slide that we could potentially show, which will kind of speak to one of the comments there. But a part of the reorganization, it kind of articulated in the report that we ended up being management heavy over the last few years. And so part of the reorg was eliminating a piece of that particular management. And as of December, in eliminating one part of the management and making some tough decisions on funding, we were actually able to offer 30 positions for individuals that were impacted by eliminating that one level of management. And so in order to, when we eliminated that one level of management, we were actually able to offer, I believe, 27 counselor positions. And so with those individuals accepting opportunities to become counselors within the agency, what that has afforded us the opportunity to do is right size the agency. And so we're making adjustments as we speak. But like I say, Robin is showing you exactly what you've indicated. You can see on this particular slide, we tried to break out how many individuals that are in VR, and over the years, what is the comparison between VR counselors and individuals that work in VR, whether it's leadership or whether it's support positions. And as you can see, when the agency was stood up in 2013, if you look at the chart on the left, there was about a 50-50 gap. Beginning in 2017, the agency made a concerted effort to focus on our case services budget and services. But we didn't do a really good job of balancing services with the people that are doing those IPEs, that are doing those eligibility determinations. Again, we can invest in resources, and we're doing that right now, but it's still, we still need people to be able to develop those interpersonal relationships and work those cases. And so hopefully you can see on this particular slide, you can see the gradual decline in counselors, but the number of individuals we served continue to stay around 35,000 individuals. So that creates downward pressure. And the pandemic did not change that. The pandemic just basically shine a light on the things that we did not invest in over the past few years. And so that's why it's hard to suggest that it's funding alone is the issue. It's been a lot of decisions that we've made as an agency that has put us in a situation that we're rebuilding. But as you can see in FY 2021, you can see with that reorg and eliminating one level of management and pushing the money and pushing the funding back into the to the front lines, we were able to increase our number of counselors from 120 to approximately 150. And so if you look on the chart on the left, it moves from 29% of your staff being counselors, which is doing the bulk of the work, to almost 40%. And so if we continue along this trajectory, we continue to make methodical decisions on how we spend money, I think we're in a prime position to be able to have a conversation to say, this is what we're doing. These are the things that are helping us improve. And we think these changes is going to allow for us to eliminate the workload that individuals have articulated, which has resulted in the customer service and the things that we're seeing related to not being able to get to clients in a timely manner. So excellent question.
Yeah, okay.
Okay, are there any other questions from the committee or comments? Well, I want to say thank you to you, Director Wells. You've jumped right in and done some great work.
Thank you. It's been a lot of support, and like I said, I wish I could say it was all me, but one of the things that I must admit, I've had a lot of really good individuals that have saw something in me and have given me opportunities, and that's why I just wanted to say, beginning of the conversation, thank you, and wanted to end by just saying thank you as well.
Great. Well, we will look forward to hearing and learning more about you quickly and soon, probably.
Thank you.
Great, great. Okay. We did advertise for public comment. We do have one for today. Today, we just made it available for those who wanted to respond to DHS and defects issues. So we are about to be joined by Mary Lee Boatwright Quinn with the Alzheimer's Association. Mary Lee, it's so good to see you, and look forward to your comments.
Well, thank you, Chair Dempsey. I am actually going to share my screen and just share a couple of slides with you all. So I guess I'm the guinea pig to be the first virtual testifier before committee, so I appreciate the opportunity. Thank you so much to your staff for coordinating this, because I know the behind the scenes is very difficult. I'm Mary Lee Boatwright Quinn. I'm the Director of Government Affairs for the Georgia chapter of the Alzheimer's Association. And for new members and existing members, just want to remind you that if you ever have questions about Alzheimer's disease or dementia or our services, or how your legislation or funding impact our constituents, I am happy to speak with you. So the impact of Alzheimer's in Georgia is increasing. Last year when I was before you, I let you know that Alzheimer's was the 6th leading cause of death in Georgia, and this year it's actually the 5th leading cause. And there is a almost 27% increase in Alzheimer's diagnosis expected in the next 5 years. Family caregivers bear the brunt of caregiving for their loved ones with dementia. Of the total lifetime cost of caring for someone with Alzheimer's or another dementia, 70% is shouldered by families, either through out-of-pocket expenses, long-term care expenses, or from the value of unpaid care, which leaves most families spending down their income and their savings, and many of them are leaving the workforce early or reducing their hours in the workforce to be caregivers. Compared with caregivers of people with dementia, twice as many caregivers of those, compared to caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties. And while most people with Alzheimer's or dementia are eligible for Medicare, this program does not cover the supportive services that are provided through home and community-based services. These services that you all fund through the HCBS budget and DHS provide in-home care, adult daycare, respite care, and home delivered meals. And these are really a safety net for caregivers in our state. They are very important to delaying costly long-term care residential stays. And any amount that we invest in home and community-based services helps to provide great savings to our state's budget by reducing those long-term care expenditures. And in closing, I would just like to say to the committee to please consider increasing access to home and community-based services in the DHS budget as you deliberate both the amended budget and FY22. And Chairwoman Dempsey, I had to include this picture because in this year that we're going virtual, I just want to remind you of the amazing Alzheimer's advocates and folks that are living with the disease who are behind the numbers that you fund the budget for. And they are going to miss coming to the Capitol to see you all this year. So thank you so much, committee, for your time and attention.
Oh, thank you. And it is important always for us not only to remember the advocates, but the real people whose lives are impacted by the dollars and spending and effort that we do and that your volunteers do as well. So thank you so much. We will miss see them. I'll probably get to see Angela a little bit, but I do. The work and their day here has been very important over the years. Here's to next year when we can do that again.
Absolutely.
Okay, so that is our business for today. Now, I hope that in the morning we have fewer technical glitches, but just to confirm, we will have some important conversations in the morning. I believe we have behavioral health and we have veterans in the morning, starting at 9 o'clock. I want to encourage all of you to watch your house email too up to the very last minute in case we have to make any changes. We're all working in such a different environment and trying to do the best we can as many committees try to meet. So if you'll just stay watchful, some information should come out later today to remind you, but then also in the morning if there's any last minute change. And the tracking sheet, Michael sent it out last night. When we gather again here on Tuesday, we'll try to make sure that each of you have a physical copy of it as well so that we can all look at that. There will be some discussions that we will need to have probably at least on Tuesday, if not sooner. So we'll be working toward that. The goal of the House, as stated by Chairman England this morning in the hearings, is for us to work very quickly on this budget. There's not a lot of money to move around in the entire budget. There's not a lot to move around in the amended. So I want you to look at, be thoughtful, be thinking about things that really matter to you and ways and places that you feel we could genuinely impact in a quick and swift way. We're going to hope that everyone stays healthy, but I think that after last year, we're all quite aware that anything could change. And so to make sure that we get the amended budget passed quickly and those dollars into all of the agencies and places where it needs to go right away, should anything create a need for us to pause and have to catch our breath before we continue to work on the big budget. Hopefully not. Hopefully we'll just coast along here. Y'all all stay healthy and strong, keep wearing those masks and enjoy when you don't have them on like we do right now. But keep wearing your mask and social distance and wash your hands and just do the best you can for you and your loved ones. There's not anything else to come before us. I will see y'all in the morning at 9 o'clock.
Thank you.
Hey.
Thank you.